guys, welcome back to Medical Coding with Blue. It is Christmas in July. Now, this is my Christmas in July weekend special. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button, and at the end, if this video helps you, I hope that you will share it. Okay, so let's get started. All right, so for the next 4 weekends, right? There's going to be 8 total episodes that you guys get from my Christmas in July special. It's going to be covering different specialties, and I will leave the schedule down in the description box as well again, okay? So in case you missed it, I did post it in the community tab, but like I said, I'll put it in the description box as well. Now, I will be leaving the links to some very valuable resources. Now, this, I got to tell you guys, is really, really huge. It's not enough as a medical coder to understand how to code, right? But really, when you start to comprehend what you're reading and what's actually happening, there's a difference. And when you get into the real world, if you're brand new, then you'll understand what I'm talking about. But if you're a veteran medical coder, then you should know what I'm talking about too. That when you really start to fully understand, then it's going to make a lot more sense. Then your eyes are going to start opening. And when your eyes start opening, then you're going to be able to find that more detail, because then you're going to know if there's something that's missing. When I very first started, my very first job in medical coding was at a cancer therapy research center. You want to talk about being thrown into the deep end of the pool. This cancer coding for any specialty is very involved. I'm going to be leaving the link for the American Cancer Society. Their piece about lung cancer is very, very detailed. And when you're reading, if you happen to be working in the oncology clinic and you're seeing a lot of lung cancer patients, this is very important, because it's going to review things like what kind of treatments are available, what more detail. What is the more detail about these conditions and things like that. And it's very important to understand it, because as I said, oncology coding is very detailed. And I never knew until I started working at the cancer therapy center that, you could have your lung cancer, you can also have it in your liver, okay? That same lung cancer marker in the liver. So I didn't know this, and there's a lot of things that you will learn. And so just take the time when you get a chance to read and go over these things. And yes, it's going to take some studying outside of the time that you are at work for you to better understand. And when you better understand what's going on, you will get faster, because it's going to make a lot more sense rather than sitting there sort of struggling and trying to figure out what's going on. Now, there's not just only that. There's the American Lung Association that I'm also going to be leaving down in the description box below, that will talk about COPD and asthma and bronchitis and every other condition you could think of for respiratory. Now, is it going to take some time for you to fully grasp all of this? Yes. When I got put into the pulmonary clinic, it was a couple of years ago I got put in the pulmonary clinic. And I had not specifically worked in the pulmonary clinic. Like, I had done some pulmonary patients. I had done that kind of coding, but I had never fully concentrated on that particular specialty. When I got in there, it was some learning time. But you know what? It was very fascinating. I really enjoyed it. And some of these websites are what I used when I was working on learning more about that website, about that specialty. So take the time, guys. It's only going to benefit you. The more you know, the more you learn, the better off you'll be. Okay, so now let's go ahead and get started with my notes. All right. So the respiratory system, or AKA the pulmonary, okay? The respiratory system encompasses the nasal cavity, the nasopharynx, the oropharynx, the epiglottis, the larynx, the esophagus, the trachea, the right and the left bronchus, and the right and the left lung, okay? Obviously, there's a lot more words that are involved, okay? There's also, the alveoli and the bronchi. So it's not just limited to just those words, okay? But these are the broad strokes of where it's, where we're looking at in this section, okay? So the diseases of the respiratory system in the ICD-10-CM are with the diagnosis codes ranging from J00 to J99. Now, I will also tell you guys that this is obviously, there's also the neoplasm table to consider along with the symptoms codes for respiratory, okay? So there's another range of codes, okay? So, but it's pretty broad, so I'm gonna leave it like that. A note in the Optum 360 ICD-10 CM Expert for Physicians edition, which you guys know I love Optum 360. However, this is not an ad, but Optum 360, if you're watching, call me. So, but there's a note in the book, specifically, it says, when a respiratory condition is described as occurring in more than one site and is not specifically indexed, right, in the index, it should be classified to the lower anatomical site. And the example that they give is tracheobronchitis to bronchitis. So if you look up tracheobronchitis in the index, in the ICD-10 CM Expert for Physicians book, you know, or even if you're looking in the other book as well, if you look it up, it's going to tell you to go to bronchitis, okay? Because it's saying that there's not a specific code for that tracheobronchitis, but you're going to go ahead and code it to bronchitis, okay? So in this book, it's telling you, it's giving you a little note and a hint, okay? So just something to look at. And review the notes in that section of the book. So if you are coding in a specialty like the respiratory or pulmonary, look in that section of the ICD-10 book, read the notes, okay? You don't necessarily have to look at all the codes, but just look at the notes if you're using the Optum 360 book, okay? At least I know that they have that in there. I know there's other publishers for the ICD-10 CM book, but Optum 360 is the one that I like and the one that I trust, okay? So moving on. All right. So the respiratory section in the CPT book, that covers the codes 30,000 to 32,999, okay? And are the lungs, and one of the questions that I ran across that I thought was interesting when I was doing research for the show, are the lungs in the front or in the back? Okay, somebody asked this question. So according to patient.info, the lungs are found in the chest on the right and left sides. At the front, they extend from just above the collarbone, the clavicle, to the top of the chest to about the 6th rib down. So it covers a lot of real estate. From the front to the back, the lungs fill the rib cage, but are separated by the heart, which lies between them. So I thought that was fascinating. It's very important to know your anatomy and understand the anatomy, the section that whatever specialty that you are working in. It's very important to know the anatomy, okay? And especially the anatomy for that particular specialty, because knowing that is really going to help when you're looking at codes versus, you know, you're looking at the documentation. You got to make sure that everything matches up perfectly, okay? So if you see a code that's selected that isn't correct, but you know that there's another code that can fit better because anatomically it is at that place or whatever the case may be, because sometimes people select the wrong code. Sometimes providers select the wrong codes, you know, whatever. It's on the coder to make sure that they are looking and they are understanding what they're reading. That's why I tell you guys. Just saying. All right, so moving on. Now, the American Lung Association. Guys, I cannot tell you how helpful the American Lung Association is when it comes to educating yourself about lung diseases, okay? So check that out, and I'm going to leave the link for that down in the description box below. I will also be leaving a link about COPD from the Mayo Clinic. Now, I really like the Mayo Clinic because the Mayo Clinic covers a lot too. It does cover like the symptoms, and it does cover, you know, what happens in the disease process and things like that, and what sort of treatments do they do for these things. So it's another really good resource to give you a lot of the broad strokes of what happens in that particular clinic, okay? And another thing that plagues the respiratory or the pulmonary section is tobacco use, right? So according to the CDC, which I will leave that link down in the description box below, according to the CDC about tobacco use, quote, 4 out of every 9 adult smokers who saw a health professional in the past year did not receive advice to quit. In 2015, 57.2% of adult smokers, or 18.8 million, who had seen a health professional in the past year reported receiving advice to quit. Even a brief advice to quit, so according to the procedure code, it's greater than 3 minutes, okay? So it is important to make sure that the provider is putting down their actual minutes. How many minutes are they spending doing this counseling in order for this code to apply, okay? So even brief advice to quit from the physician improves the cessation rates and is highly cost effective. When you think about it, smoking does a lot to the body. It affects a lot of the organ systems. It affects the vascular system, of course, the pulmonary system. It can also affect the bones and the musculoskeletal system, because when a patient is a smoker, they're not able to heal right away, and it does impact their ability to heal after surgeries, and it doesn't matter which surgery, right? So it does impact a lot of patients if they are a smoker, and it does affect their health, okay? So when a provider, and if they're doing a tobacco cessation counseling, make sure that they are documenting properly as well. There, if you look in the book at 99406 or 99407, those are your tobacco cessation counseling codes. Be sure to review those and be sure to talk about that with your provider if they are doing those counselings. Now, sometimes they may not know that they can actually do that, but they are their physician and they can counsel them. So they need to know, what was talked about. Did they try to quit before? Are they willing to quit now? Are they willing to go to tobacco cessation classes, or are they willing to follow up with their primary care for tobacco cessation aids, like being prescribed some gum or something like that, or the patch. Those things are very important to make sure that they're documenting those things, as well as the time, okay? Because there's two codes. The first code is the 99406 is from greater than 3 minutes up to 10 minutes. And then the second code is from 10 minutes and above. So that's why it's very important to have them document how many minutes are you spending doing this counseling with this patient about tobacco cessation, okay? Because it's going to affect, right? It affects the code. So just something to think about. Now, when we started doing this at our facility, there was a campaign going on at our facility about having people quit smoking. There is a large population that does smoke. So they wanted to do a campaign to help to bring those smoking numbers down. So there is printable resources. Now, this was something that I proactively did for my providers. I made sure that I printed out, because the CDC has printable resources that they can give the patients, that gives them all the information about where to go for help to quit smoking, some of the things that they can do to help them quit smoking. And these were wonderful flyers for the provider to give to their patients. So this was going above and beyond, because normally coders don't do this, right? It's normally like the nurses that do it. But I'm their coder, and if they're having to do this, it's nice to have a supplement for them to give to the patients. And this was like, wow, they were like, really, Blue? Like, wow. But the patients liked it, okay? And then the providers really appreciated it. So there is the link down there if you want to give that to your providers, if you want to help them and talk to them about that. That's all a part of CDI, that clinical documentation improvement that will help you and them together, okay? And this is better for the patient, because if they are being counseled to stop smoking, then it is good that it is in their documentation as well. So you want to make sure that you're doing things like that, and helping with the tools like those things, okay? Just saying. So, and then I'm gonna the other links that I have here, I'm going to put them in the description box, but they are all really helpful. Some is from Medline Plus, and of course cancer.org, and of course the CDC. So I want to thank all of them for having really good websites and lots of really good information about all the types of conditions when it comes to the lungs, okay? And so there's like I said, with tobacco, use that affects the lungs. And vaping is also very dangerous. And it's also another thing to look at when you are doing your research as well. And F17290 is the code that covers for vaping, okay, because it's other, okay. And then an interesting little factoid. COPD and asthma unspecified is only coded to COPD. Okay, this is because COPD, if you look in the book, it says that COPD includes asthma with COPD. However, this is where the detail comes into play, folks. However, COPD and, for example, asthma intermittent can actually be coded separately, but together, because the asthma is specified. So if the asthma is not specified and the patient has COPD, then you only code the COPD. But if the provider adds the detail about the asthma and they have COPD, then you can put them two together. So that's just for example. That example is mild intermittent. They could have moderate, they could have, severe, you know what I mean? So, that's just an example. But the whole point is that they were detailed, okay? So if you see only asthma unspecified, then you would only code COPD. And then if you see asthma, like mild intermittent with the COPD, then you can code them both. So again, that's when it goes back to clinical documentation improvement. This is why we need that detail, because the detail is going to affect the code assignment, okay? And at the end of the day, it's really important. And sometimes you may hear, well, I don't really know. I'm not sure yet if the patient actually has this or they have that or whatever the case may be. If that's the case, then that's fine, because sometimes diagnostically they need time, right? They're waiting for test results, or they're waiting for, whatever else to come in. And that's okay. But if they know, and by talking to them, you will be able to know if they know or not. And these things they can happen in classes, when you are giving an in-service, and you're talking about, ways to improve clinical documentation improvement. That is one of the things that you can address. If you see that as a chronic thing, right? Well, I see a lot of asthma unspecified. Is it unspecified, or are they, mild intermittent, or are they moderate or severe, whatever the case may be? Is this happening? And then you may get, well, I didn't know that we had to document that. So then that's when that good communication really comes into play. So I hope with doing these breakdowns of these individual specialties, that will help kind of open your eyes to some of the things that maybe sometimes we don't think about, and we don't think about these things because if we don't talk about them, of course, how will we know, right? So I hope this helps, And I like this. And I was just like, okay, don't give them too much information, Blue, because it's just like, trust me, I had to cut this down because this was like another couple of pages. And I was like, no, I don't want to give them too much information. I'll just give them just enough, and then they can do the research too as well. But I had a lot of fun. And tomorrow's episode will be another specialty. So I hope you'll tune in tomorrow at 7:30 Central Standard Time. So anyway, I hope you all have a wonderful and safe, I was going to say New Year's. It's not New Year's yet. 4th of July. See? It's 4th of July. Hope you'll have a wonderful and safe 4th of July. Please stay safe, guys. And I will see y'all on the next episode. So if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.